Science is terrifying, amazing, magical, explanatory, and more. Science is all around us all of the time. How we evolved, what we eat, and all our medical and health advances. Welcome to Health Discovery. In this video, we talk about the 10 surprising health and medical discoveries that could change your life. Before we get started with the video, don't forget to smash the like button, share the video, and subscribe to the channel. Now let's get started. Number 10. Control of dementia. In the UK, there are 700,000 people living with dementia, and by 2030, some experts believe that figure will have doubled. Therefore, the search for a treatment, or at the very least a way to stop the disease in its tracks, goes on. Gammagard, a human blood product loaded with disease-fighting antibodies that target beta-amyloid, a molecule suspected to be prominently implicated in the brain damaging process, is one promising treatment currently undergoing clinical testing. This year's clinical trials showed that those who received the medicine, which was injected directly into the veins, lost fewer brain cells. When compared to individuals who received a placebo, it even boosted mental abilities. Number 9. Artificial cornea. Many blind people may have hope if a new kind of artificial cornea is developed. The cornea, a transparent, dome-shaped covering that covers the front of the eye, functions as a window by directing and controlling the amount of light that enters. Loss of sight results from illness or an accident. The main remaining hope has been to wait for a corneal transplant from a deceased donor. But this involves matching the donor and recipient, and there is always a chance of rejection. Some plastic artificial corneas have been known to be prone to problems and infections. However, patients in Sweden have now had their sight restored thanks to artificial corneas, manufactured by sewing a thin piece of collagen into the eye, rather like a contact lens. That the collagen encourages the eye's own corneal cells and nerves to grow back, restoring sight, is extremely brilliant. Larger investigations are required, but the outlook is encouraging. Over 80 people with chemically damaged corneas have had their sight restored thanks to stem cell therapy. Number 8. Control of high cholesterol. 1 in 4 men and 1 in 6 women in the UK die from coronary heart disease, which has high cholesterol as its primary and most avoidable cause. 95 genes have been linked to high cholesterol in fascinating research that analyzed data on 100,000 people. Even if eating foods high in saturated fat, such as bacon and cakes, elevate cholesterol, our risk is also increased or decreased by our genes. The next stage is to investigate the function of each gene, both independently and in combination with the others. Once that's completed, particular pharmacological therapies may become accessible during the following 10 years, drastically reducing the prevalence of heart disease. The medication statins, which are currently used to control cholesterol, can only reduce levels by about 25%. Number 7. Defibrillator. A defibrillator shocks the heart of a patient undergoing cardiac arrest, which occurs when the heart stops beating. William Cohenhoven, an electrical engineer, produced the external defibrillator in 1930. The defibrillator was then effectively employed in heart surgery for the first time by cardiologist Claude Beck in 1947. Number 6. Osteoporosis Diagnosis. The bone-thinning condition osteoporosis may soon be diagnosed with a laser. Raman spectroscopy is a method that makes use of portable, handheld laser equipment to analyze tissue rapidly and painlessly without the need for an X-ray scan or the removal of tissue samples from the body. It has already been utilized at the U.S. University of Michigan to investigate the bones of deceased individuals and is especially well suited to bone analysis. They intend to use it to forecast fracture risk and evaluate the efficacy of treatment in trials on individuals with osteoporosis. If it works, it would be more efficient, less expensive, and more accurate than the methods currently in use. Additionally, because it doesn't use radiation, patients might be better monitored. Within 5 years, researchers expect it will be put to use, detecting breast tumors, testing cholesterol, and recognizing tooth decay are some further possible applications. Number 5. Drugs for breast cancer. The more information scientists learn about genes, how they function in various types of breast cancer, and how they respond to medications, the more individualized treatments will be. A method to analyze 829 genes responding to a breast cancer treatment in breast cancer tumor cells was devised earlier this year by scientists at Cancer Research UK. They determined which components, if absent or flawed, would prevent the chemotherapeutic medication paclitaxel from functioning. Now researchers need to figure out how to turn this into a quick test that can assist physicians in deciding which medications to recommend for which patients. This could potentially be applied to additional breast cancer medications, giving every patient a personalized treatment plan with a higher likelihood of success while also saving money. It's wonderful news, especially in light of how expensive some of the newest medications are. While this was going on, a group of researchers from the University of Edinburgh identified the gene that causes the aggressive breast cancer HER2 to spread throughout the body so quickly. Drugs to inhibit its action and halt its spread are still being developed. Number 4. Knees replacement. Every year in the UK, 70,000 knee replacements are performed, primarily as a result of osteoarthritis wear and strain. However, a project being conducted at Keele University in Staffordshire is looking into ways to heal damaged joints by combining patients' stem cells with their cartilage cells and injecting the resulting mixture into injured knee joints. The cells haven't previously been combined. This is the first time. At the end of the year, the experiment, which is supported by Arthritis Research UK as part of a 5-year research program, will be conducted on 70 patients. Not only for knee replacements, but also for hip replacement operations, it is believed that this will one day be a viable alternative to surgery. Number 3. Hearing. Our inner ear's hair cells do not regenerate when they die. Due to the fact that hair cells are essential to the hearing process, our hearing declines with age. The supporting cells that surround the hair cells in the ear can be made to resemble those cells by merely adding one gene there. Finding a method to restore all or most of the hair cells is the next stage, which might potentially do away with the need for cochlear implants and hearing aids. Number 2. Test for prostate cancer. There has long been a demand for reliable prostate cancer screening tests. Many men undergo additional needless testing and treatment because the blood test used to evaluate levels of a marker called prostate-specific antigen is less than 50% accurate. At Oxford Gene Technology, scientists have now discovered a group of proteins that point to the existence of prostate cancer. It is believed to be 90% accurate at separating cancer from other tissue. The presence of these proteins may indicate the disease years before symptoms appear. A screening program, similar to cervical screenings for women, and a sharp increase in survival rates could result from large-scale trials that are effective. In the UK, the illness kills 10,000 men and affects 35,000 annually. A trial of a male contraceptive injection is being conducted in the UK with 80 couples. The hormone injections, which contain both testosterone and progesterone, are administered every 8 weeks and deceive the brain into turning off sperm production. Number 1. CERVIX. A promising technology from the University of Sheffield might send the results before you have put your clothes back on, instead of making you wait 5 weeks for the results of a smear test and even longer for subsequent investigations. The APX is a portable gadget that resembles a TV remote control with a probe that resembles a pen on the end. It is placed on the cervix's surface and produces a modest, harmless electric current after that. So that's all for today's video. Please let us know in the comment box about your opinion, and do recommend some topics you want to see in the video in the future.